Houston Health Department continues to build upon our already robust commitment to combating the deep health disparities and inequities amongst the city's underserved populations. Our underserved communities have unmet social needs, putting them at a disproportionately higher risk for many chronic and infectious diseases. This has been highlighted and exacerbated by the COVID-19 pandemic, particularly within our Black and brown communities. 48% of the 4,800 people who lost their lives in Houston have been Hispanics. And maternal and infant mortality rates are far higher in our Black communities. Black women are 3 times more likely to die during childbirth than their counterparts. To combat these disparities, Texas Southern is starting a center for transformative health. The City of Houston Health Department and the City of Houston Complete Communities Initiative on Health Equity and Disparities will partner with the Texas Southern Center for Health Disparities, and I've authorized the City of Houston to contribute $1 million as seed money to the Texas Southern University Center for Transformative Health. With it, we are building a foundation for the Texas Southern Center, which will support many critical areas in our city. Through expertise, capacity building, training service, and research, this center will serve as a resource center for our entire city. Why is this so important? I grew up in this city, and I grew up at a time when parents did not have any private health insurance. There are many neighborhoods in our city where there are huge, huge health disparities. If there's any institution that should focus on those health disparities in our communities of color, it should be Texas Southern. On a personal note, 6 months ago, I was en route to lead a trade mission to France, but I had a toothache. At least I thought I had a toothache. And I decided before I catch that plane that I would go to the dentist to get that toothache taken care of. But when I went to the dentist, they discovered much, much more. And 2 weeks later, I found myself in surgery for 9 hours to remove, not the tooth, but to remove this bone growth on my jaw. And then after that, because they wasn't sure that they got it all, I found myself 2 weeks later going through radiation for 6 weeks, Monday through Friday, every single day. But I'm the mayor of the city of Houston. I have the best health care that anyone can think of. And because I had good health care, I am standing before you, still the mayor, still alive, giving this commencement speech. I want every Houstonian to have the same level of care that their mayor has in this city. And I believe it can start with Texas Southern University. I think we have that right, that moral responsibility, and we are to make it happen. And this city ought to partner with Texas Southern.